Okay. I want to discuss first the risk factor of diabetic retinopathy. Okay. The risk factor in diabetic retinopathy is first the duration of diabetes. Okay. Second, the poor control of diabetes. And third part, the presence of pregnancy, the presence of hypertension, the presence of obesity, the presence of smoking, the presence of nephropathy, the presence of hyperlipidemia, and smoking. Okay?
Okay, ma'am.
If you cannot understand anything, please tell me that you are not understanding.
Sure, ma'am. Sure, ma'am.
Okay?
Yeah, ma'am.
Thank you very much. The signs of diabetic retinopathy are microaneurysm, retinal fiber layer hemorrhage, dark round hemorrhage, hard exudates, cotton wool spots, diabetic maculopathy, which may be focal, diffuse, cystoid, macular edema, or the presence of ischemic maculopathy.
Yeah.
Do you know what is the ischemic maculopathy, doctor?
Ma'am,
do you know?
Capillary hemorrhage kind.
No. The
No.
presence of ischemic maculopathy is the presence of ischemia associated with macular edema.
Okay.
Okay. The presence of venous anomalies, the presence of intraretinal microvascular abnormality, and the presence of neovascularization. So, diabetic retinopathy, including microaneurysm. Okay?
Yes, ma'am.
Doctor, are you with me?
Yes, ma'am. Audible.
Are you with me, doctor?
Yes, ma'am.
Doctor, I want you to ask me whatever you want. I want to give you all what I have learned from my professors. Okay?
Yes, ma'am.
Don't hesitate to ask me anything, please.
Sure, ma'am.
Okay, doctor?
Yes, ma'am.
Thank you very much. Okay. Now, I want to see you clinically the signs of diabetic retinopathy. Okay?
Yes, ma'am.
This is the left eye, doctor. Okay?
Left side. Okay, ma'am.
Because I don't have enough time, so I have to run. Okay? This is the left eye because the optic disc is in your left hand.
Left hand.
You can see
the
optic disc now?
Yes, ma'am. Yes, ma'am.
It's on your left hand. This is the macula.
Yeah, ma'am. Macula.
Which is on your right hand.
Yes, ma'am.
Okay?
Yes, ma'am.
Okay. What you can see now is the cotton wool spots here. This is the cotton wool spots.
Cotton wool spots. Yes, ma'am.
Which is infarction in the retinal fiber layer. And here, this is dots, fine, tiny dots. Okay? Funny, tiny red dots. And this is small red dots. Okay? And
yes,
this is the macula. We have here dots of hemorrhage, blots,
yes,
and blots of hemorrhage. Okay?
Yes, ma'am.
Here, what you can see here is the dilated and tortuous veins. You can see here the dilated and tortuous vein. Yes?
Yes, ma'am. Yes, ma'am.
This is a sign of hypertension.
Hypertension.
Okay?
Yeah, ma'am.
Okay. And this is the fluorescein angiography image of this patient.
Yes, ma'am. Okay.
Fluorescein angiography, please write with me. The fluorescein angiography, how to comment on a fluorescein angiography figure. Either it's hyperfluorescence, which increase in size and intensity, and this means leakage of the dye, which occurs in edema, or the neovascularization. Can you write with me, please, doctor?
Yes, ma'am.
Okay. Or hyperfluorescence, which increase in size but not in intensity, which is the case in staining of the dye, and it occurs in membranes. Okay?
Yes, ma'am.
Hypofluorescence, which occurs in ischemia, and it appears as dark gray in color, like here.
Dark gray color.
Can you see?
Yeah, ma'am.
And here. And blocked fluorescence, which appears dark black in color, which is corresponding to the hemorrhage. Okay, doctor, are you with me?
Yeah, ma'am.
Okay. Can you differentiate, doctor, between the microaneurysm and the retinal hemorrhage?
Ma'am, in the hyperfluorescence, it basically with ischemia, and the color will be the dark gray color.
The hyperfluorescence, which occurs due to microaneurysm, it's small hyperfluorescence. Okay?
Yes,
like here, small dots of hyperfluorescence, small dots of hyperfluorescence corresponding to the small tiny red dots in the colored photography. However, the blocked fluorescence occurs from hemorrhage is like here. Okay, doctor, here we have ischemia, which appear as small, as large area of hypofluorescence, which occurs due to capillary non-perfusion. Okay,
Yes,
here there
yes,
is no capillaries, no blood vessels.
no blood
Here, this area has no blood vessels. This area has no blood vessels. This area has no blood vessels.
No blood vessels.
This area has no blood vessels. This area has no blood vessels. And it appears as dark gray in color. It
Dark gray.
corresponds to the capillary non-perfusion, which means ischemia.